I guess since we're at 2 minutes after we have about 25 people on, we'll get started. Thank you all so much for joining. I'm Karen Howard from Mental Health America. We'd love for everyone to stay muted at this point. You're welcome to keep your cameras on or turn them off. It's totally up to you. We will have some time for question and answer towards the end of this conversation. We'd love for it to be kind of an informal place to learn and share. And we just appreciate you being here today. So Mental Health America is a consumer advocacy organization with affiliates in 41 states, including where I live in Florida, which is also where Sherry McDonald is joining us from. We are also looking at expanding. So if there is, interest or opportunity, we'd love to have support from, anyone here to either connect with our affiliates or join as an affiliate. I'm the Director of Policy and Advocacy at Mental Health America, and one of our priority policy issues in 2022 really is moving legislation and policies that support the pregnancy, childbearing, and kind of postpartum period after childbirth. And there have been a lot of great changes in the last decade that have supported these processes, and the need, though, is great. Mental Health America's newest online screening assessment is postpartum depression, and over 75% of the people who take a postpartum depression screening screen positively for moderate to severe postpartum depression. And so we're seeing a great need in this space. However, there may not be as much information about access to support and services, as well as there's still some growth that needs to be made in coverage of services that support women and those who are expecting and recently giving birth. We talk about the perinatal period as it relates to kind of before, during, and after childbirth. But we're actually going to move this conversation a little bit more upstream and talk as well about the period of gestation or trying. And we have an infertility blogger that's joining us to talk about some of the issues that have arisen in the process of trying to start a family or in family planning that are not always discussed, especially as it relates to women of color who have experienced infertility more so often than other women. So I will kind of leave it there and allow our panelists to introduce themselves. And we'll start with Sherry and Suzanne, and then I'd love Tanya for you to share after them.
All right, hello everybody. Good afternoon on Friday. Thank you for joining at your lunchtime or just break or just kind of getting out early today. I'm really happy to be here. My name is Sherry McDonald Sawyer. I did get married last year. So yeah, I'm really happy to be here and provide perspective of mental health as it relates to infertility, particularly women of color. Going through my own experience with infertility and treatment, of course, have gone through, a lot of just physical changes, mental changes as a result. We've been on our journey for a little over 2 years now. And, I would really just like to share my experience and just talk about, ways to kind of help support yourself and others through infertility by way of mental health awareness and self-care. So as a result of my experience, I've really taken a very strong interest and passion into advocacy in this space. So, in my own outreach of getting support, also providing support and guidance and help to other women just going through the same thing, other families as well. So I'm really happy to be here.
Hi everyone. I'm joining from Maternal Mental Health Leadership Alliance. We are a younger organization, but we're completely devoted to maternal mental health in the policy realm. And so in a bit, I will share our 3 legislative priorities addressing maternal mental health and raising awareness amongst the general, general populace of the severity, the frequency, and the racial and economic inequities existing in this field, the access to treatment, access to barriers, and how that relates to the birthing person, partners, babies, families, and society.
Great, thank you for the invitation. Thank you, Karen, and it's great to join you, Suzanne and Sherry. I'm Tanya Fullwider, and I'm coming from Columbus, Ohio, and as Karen mentioned, an affiliate of Mental Health America, as Mental Health America of Ohio, and we've been an affiliate since 1956. I have not been on staff since then. I co-founded an organization called POEM, Perinatal Outreach and Encouragement for Moms, in 2003. And we continued to grow and develop that organization. And in 2011, 12, the then director of our affiliate here in Columbus at Mental Health America, we started having conversations about collaboration, which ended up in a formal affiliation with the POEM becoming a program of Mental Health America of Ohio. And the alignment was perfect because the POEM program very much focuses on access to care, on gaps in the system of care, and does that all through a peer support delivery model. So we have this incredible team of certified peers who are directly linked to those who are serving pregnant and parenting people every day, and working with those frontline providers to ensure that the folks who they're sending to our peers have all the support tools and access to care that they need to be the parent that they want to be. So happy to be here too, and look forward to the conversation.
Thank you. One of the things that both you and Suzanne, Tonya, started discussion about is the birthing parent and the parent. So we don't oftentimes discuss some of the changes that fathers or other partners who are non-birthing go through. And I think it's important to recognize that there's, a duality that is, the birthing parent is experiencing some distress. There's likeliness that the other parent is as well, and maybe having to pick up for some of that slack. And I think, Sherry, you've also discussed in your process of fertility and infertility treatment that there is ups and downs that both you and your husband or your partner have experienced. And there are times where you feel that one person has to be kind of the holding up the other person during times when that other person might be experiencing low lows. That in a sense of the partners supporting each other can be considered like peer support in a way. It's not necessarily a trained peer specialist who's providing, kind of medical, clinical, or like official educational support, but there is some, balance that happens between the two partners who might be experiencing both infertility or the new change of having, a new person in the home that requires 100% commitment.
Right.
So I'd love for Sherry to just, discuss a little bit about how, you and your partner have managed to go through some of the challenges and changes that you've experienced, and whether or not, there are some tools that have been useful for you in your education and growth during this process, especially as it relates to being a woman of color.
Yeah, absolutely. I would say the number one thing with infertility amongst my husband and I that we both had to be very conscious of was, number one, clear communication between both of us, making sure that, we were communicating our feelings, asking each other, how are you feeling? That small question right there just goes so far. We were always very involved in therapy even before we were married. So therapy was a great tool for us to kind of give us a good solid foundation in terms of knowing, like that gave us a really strong tool set. So when we did get in like a bind or someone was not able to communicate, we kind of knew how to get out of it. But also, I would say grace was really important as well. Understanding that the way that I process things is very different from the way my husband processes things. And we kind of had to get there through a little trial and error of like, well, why aren't you responding to this way? Like I am so overly emotional about it. And maybe, he's not, but, him communicating to me and saying, hey, like I'm trying to hold it together for the both of us. And I just process things differently. It kind of helps me to understand better, when things happen or things don't work out or they do work out, and not maybe taking his response or, him taking my response as something negative and just saying, oh, well, that's maybe just how they process it. So I would say like therapy is great as a couple, but individually as well, that was a very strong tool for me. There are therapists that specialize in maternal health, pre and postnatal care, depression, all that, and infertility. So the therapist that I got was amazing. And she gave me homework and just terms of how to process the day-to-day, because with infertility, things change every day. And you're given like, every day is another victory or a non-victory. And you have to be able to prepare yourself for being able to, accept whatever news you're getting that day. Either, your eggs are not mature enough to do an egg retrieval, or you're not responding to the medications, or you are responding to the medications. Now we're going to prepare for egg retrieval. And then once you get to egg retrieval, now how many embryos did you get? So there are all these small little milestones that you have to encounter in infertility, and being able to endure that as well as work every day, because, I'm going to these appointments before my work day in the morning at maybe 7:30 in the morning, and then I'm getting, news by 1 or 2 o'clock in the afternoon about what's happened, but I have a big meeting at 3 o'clock that I still have to lead. So I say communication is key with your partner. Tools I would say that are very important or necessary are therapy. And therapy doesn't always have to be, like you said, it doesn't always have to be so formal of like a therapist. I mean, my husband and I counseled each other all the time on small things, but also with that, realizing that, you can't always rely on your family and your friends and your partner to give you the mental support that you need sometimes if you kind of feel yourself getting into like a dark place. And so that's where I encourage, professional help if needed. And then another outlet for me too, there's tons of Facebook groups related to maybe the clinic that you're going to for infertility treatment. There's a lot of women of color Facebook groups that are related to infertility where I found tons of support. And sometimes just talking to people that are going through the same thing you are on a day-by-day basis, like, hey, I had this appointment today. Oh, I had the same appointment. That helps so much just to have someone who understands 100% what you're going through. So yeah, those are some of the tools that I recommend, and just some ways that my husband and I kind of help support each other.
Sherry, you touched on so many really important themes that also relate to policy. So you talked about the importance of, having a support system close to home, and some people have that to turn to and other people don't. You talked about the importance of going to seek professional help and some of the challenges that arise with that. So one of the biggest issues with mental health parity is that there are all of these networks of doctors and therapists who are supposed to be available for professional health. And when patients or consumers start looking and trying to set appointments, it comes up that, well, wait, these people aren't accepting new clients. These people are not trained or specialized. Or once I visited this person and had a couple of sessions, I realized we're not really compatible. I say finding therapists is often like dating.
Yeah.
You have to find the right fit. And, you know,
Yeah.
some people do want that homework or that extra step. And some people may need some even more intensive types of interventions.
Right.
When it comes to like network adequacy and ensuring your health plan or your insurance provider has this robust, you know, provider workforce to choose from, it's just not there. And I think
Right.
there are a couple of pieces in the omnibus legislation that are helping to, that would help to train a professional workforce that's dedicated and specialized to treat women of color or birthing parents of color, and grow that workforce of culturally responsive and humble providers. Suzanne, would you be able to talk about some of the, you know, parts of the Triumph and Into the Light Act as well as the omnibus that speak to workforce issues?
Yes, absolutely. So we have three big legislative priorities, including that pushing for the extension of Medicaid for birthing individuals to the first year postpartum, because you know, we do have these inequities. It was occurring in 1 in 5 birthing individuals. Now that number has increased threefold. And so during that the latter half of the first year is where we can meet, where women are most dying, where we need to catch them. And you know, these are deaths that are entirely preventable. On the Moms Matter, the Moms Matter Act, which is a part of the omnibus. So far, we've had one push through, which is the Veterans Bill. The big thing here is addressing maternal mental health equity, which is being pushed by Shades of Blue project. And it's to grow and diversify the maternal mental health workforce, with that big focus on health equity and parity, as well as create grants for community prevention, intervention, and treatment of maternal mental health. And like you said, incorporating compassionate, culturally appropriate, you know, workforce, so that we are addressing the whole aspect. And like you said, the fit is really, really critical. The legislation that we had introduced by Rep. Catherine Clark earlier this year is Into the Light for Maternal Mental Health and Substance Abuse Disorders. And so with that, we have gotten in law a maternal mental hotline. So that's 24/7 voice and text. It will be English and Spanish. Ideas to get it off the ground this year, but to authorize funding to make that permanent, as well as to get these grants from HRSA to leverage the existing workforce within states. They're called perinatal psychiatry access programs, and we have them in a number of states, but we don't have them across the board. We need that care from in-state providers, because they have that specialized knowledge, and they're also, I think Sherry mentioned, you know, these are trained individuals in that perinatal window, that reproductive health realm. And so they know specifically the challenges. And so this way a woman can walk into her OBGYN's office, be screened, and if she's flagged, that OBGYN has the training and the knowledge to start her on a medication, if deemed necessary. And for the most, you know, and they can call up and perhaps get referrals from these state psychiatrists and reproductive health for the most complicated cases. And so we're using existing infrastructure to get access for more women. And then there's the Triumph for New Moms Act, which is being pushed by 2020 Mom, one of our other sister organizations. And that is specifically geared towards improving federal coordination of maternal mental health programs and governance. So creating a national task force to eliminate duplication and to identify opportunities to integrate maternal mental health. So it's not a bunch of fragmented organizations doing it, but rather it's a collective, cohesive effort together. And it's also to develop a strategy and recommendations to governors, so state by state, to improve maternal mental health within their states.
I also wanted to note that, the White House put out a proclamation in honor of Mental Health Awareness Month, as well as Black Maternal Mental Health Awareness Week, which was in April, and Maternal Mental Health Awareness Week, which is this week that we're ending. And they highlighted some recent actions, such as starting a program to designate birthing-friendly hospitals. So, once a family might get through the fertility process, there might be some increased anxiety that they're feeling because of the horrible rates of maternal mortality, and this sense of whether or not I'm going to get the best care when I go into this hospital. There are, figures like Beyonce and Serena Williams come to mind that had near-death experiences in childcare, and they have all the money in the world and access to the best doctors, but there's an issue of mortality, and that's unfortunately the U.S. has a really one of the highest mortality rates of moms during pregnancy. So the Into the Light Act, the Triumph Act, and the Momnibus bills, hopefully will come to pass in the next year or so. But right now there are some implementation kind of activities happening at the state and local levels that will hopefully help to promote and reward hospitals and doctors who are giving the absolute best quality care. We have now, I think April was the first month that Illinois and other states actually started covering moms who are Medicaid beneficiaries. And who are Medicaid beneficiaries who will not only have health insurance through Medicaid for their baby, but now will have it for themselves and their own personal needs up through 12 months after delivery. And that's really a huge win. And I think kind of builds on top of the essential benefit that the Affordable Care Act created, ensuring that all health plans, no matter whether it's through employer-based insurance or otherwise, they all have to have a maternity benefit. Whereas before the Affordable Care Act, which passed 12 years ago in 2010, before that, insurance companies would consider a pregnant woman as a pre-existing condition and may deny treatment or care. So then that woman, may or may not have access to health care during a time where there are a lot of body, physical, and mental health changes happening. Tanya, I wanted to kind of lead into the importance of, support system and how the POEM program really integrates or engages with kind of medical or clinical support that's in place. So in addition to having, a physician and perhaps another, doula or midwife or someone else to help during the birthing, how else does peer support and the POEM program really engage?
Sure. Great question, Karen. And to piggyback off of, a couple things that have been brought up, we're very happy that here in Ohio, Medicaid was extended for the first year, for the full first 12 months in our last budget. So that was a huge win for us in our state. And you brought up parity, and I think in mental health, and in particular in maternal mental health, we really have to be very mindful of that parity conversation, because mental health doesn't fit a medical model. So we don't only want on par with the medical model around physical health. We want more than that. We need more than that. We need to have human-centered interventions, right? And we can look, and Ohio is no exception, of the abysmal maternal and infant morbidity and mortality rates, and the disparities, particularly for Black and African American pregnant parenting folks. I mean, the disparities are just, it's just inexcusable, right? And so we really have to look at, okay, what are we doing? What are we putting money into that's absolutely ineffective, right? And so it's going beyond that therapy or bust, meds or bust. Those things are important, but they're part of the picture. We have to think about doulas, and we have to think about each individual person and what their needs are, and meeting them where they are. Are they connected to a community health worker? Are they connected to a doula? And are they connected to a trained peer supporter who can help provide them options? Are they connected to a peer supporter who looks like them? And particularly in the context of the disparities that we see in the Black and African American community. So we're very happy and really proud that the POEM program, a central part for the last few years, is what's called a branch called RISE, which RISE is peer support specifically by and for Black and African American moms. And it's just, the work that they're doing is just incredible, and it's saying, from the moment that you have the opportunity to connect with, your care provider, whether that's, a midwife or an OBGYN or, any frontline care provider, that we hope you here in Ohio have the opportunity to talk about your mental and emotional health, and then be connected to a peer who can talk with you about all of your options from a standpoint of, I've been there, I've been through this path, and I can walk alongside you and present those options. And whether that's a therapist or a support group, or maybe it's 3 or 4 conversations before we even talk about what treatment options there are. But, really important to have that, human-centered approach that peers are really good at.
So peers are people with lived experience who are of a mental health condition or substance use disorder that are further along in their recovery, and then come back to kind of help others who are kind of struggling earlier on in their recovery. And a peer can help a person identify that, okay, there's issues and there are some goals that I have for myself, right? And then a peer can help a person figure out, okay, well, if those are my goals, how do I go about reaching that? For instance, if there's a person who is experiencing hallucinations, or because today is, can you tell the holiday time?
Sure. Alana, you want to go?
Absolutely. Perinatal Psychosis Awareness Day is today, which, fortunately, perinatal psychosis is very rare in contrast to maternal mental health complications across the spectrum. But it is important to recognize that as a distinct disorder, which is today.
Yeah, and the U.S. Preventive Services Task Force, in 2019, basically came up with this, or shared this research, that there's a vast majority of birthing parents who experience perinatal depression, either before, during, or after childbirth. And the risk factors are kind of just being a woman in America. The risk factors are, relationship violence, or a history of relationship violence or abuse, having an unplanned or unwanted pregnancy, stressful life events, social and financial kind of instability, where we have a great kind of class war going on between the haves and the have-nots, and it seems like the rich are getting richer and the poor are getting poorer, and we see that disparity continuing to grow through the pandemic. So who are the haves and have-nots, and a lot of birthing or women who are wanting to birth find themselves in kind of situations that are maybe not ideal for their mental health. So how do we, encourage people to reach out and ask for help, and also do some own self-advocacy, like, hey, I am an expert in myself. If I walk into a room with any physician or, professional, how do I ensure that my voice is heard and what I'm saying is a part of, the decision making that goes into what next steps are offered?
I think part of it is, when these birthing individuals are ready to step forward and use their voice, that it's almost kind of cathartic to be able to be involved in advocacy efforts. And so we had our Congressional Advocacy Day in March. And so we had people meeting with congressional leaders and their staff, as well as social media amplifiers. And so that means basically anyone, regardless of whether you have experience or not, you can step up to the plate and speak to your elected officials. Or you can do that through social media. And every time a legislator hears about this from a constituent, the more they're going to pay attention. And so we really need to be the squeaky wheel. We've made some progress, but it's not enough. We need to keep pushing. And so we have an advocacy toolkit available to anyone that wants to become an advocate for maternal mental health. And so, yeah, we want to
That's
be
really exciting. Can you drop your website in the chat?
absolutely. We have lots of resources. We're geared towards education, prevention, screening, because there are all these places and gaps where we can be, screening for these things. You have all of these appointments with your OBGYN, as well as the well baby visits. And so, the voices that can come forward also help destigmatize these things. And so women feel less afraid to come forward. And as you mentioned, there are a number of different barriers, but if the more often we are able to speak about it, the more we can remove that barrier, the stigma. And so women who are really in need can step forward and get the help they need. Otherwise, we're looking at a lot of dire consequences, as we've mentioned.
Yeah, one of the things that, data shows is that when there is poor mental health in childhood, starting from before birth, when there's ACEs, trauma, unhealthy attachment styles, from 0 to 5, that impacts a person's mental and physical health later on in adulthood, in their 30s, 40s, 50s. Hypertension, diabetes, obesity, and other chronic illnesses that we have, kind of an epidemic of in America. A lot of them can be tied to how, the family was treated in early on, and how the child is treated early on. Sherry, I wanted to go back really quickly and then open it up for questions for the last 5 or 10 minutes. I wanted to go back to something that you said, which was how your fertility treatments and the process of realizing that you were having trouble starting a family at the time you wanted to, is that you have to go back to work. You have to go and turn yourself on and be available and be, a productive member of society when you might be going through depression or anxiety or even by experiencing maybe bipolar or other mental health conditions. I know that the ARC Fertility released a white paper recently on employment benefits and how a part of employers becoming an anti-racist place, they can ensure that their benefits cover the health conditions that women of color go through. And that could be Black or Latino or Asian, American Pacific Islander. It can be Indigenous or Native American women. But in particular, if fertility treatments are covered by health insurance, that takes some of the burden off of the family and kind of involves a workplace component as well. Do you want to share at all about maybe your experience with your insurance?
Yeah, absolutely. So I've worked at 2 companies that fortunately have covered infertility treatment. And the funny thing is that in the infertility community, one of the Facebook groups that I'm in, the administrator of the group has put together like an entire huge spreadsheet of all the companies that offer fertility coverage through a company called Progeny. Progeny is a fertility benefit that complements your medical insurance. So a lot of people now are quitting and leaving jobs that don't cover infertility to seek out these jobs that now do cover infertility treatment on their own or through Progeny. And me personally, the last company I was at was an insurance company, and they did offer, infertility coverage. And that was a large part of why I even took that job. It does take a huge burden off of financially of just paying for it. But still, I would say, even the company that I work for now, they have amazing benefits, and they offer even 6 months of maternity leave, which is unheard of. Plus you get like 6 to 8 weeks of family medical leave. So I have a coworker who took 8 months because she had to take some time before she delivered, just mentally to prepare for giving birth, going through infertility, giving birth, and then just the recovery afterwards. So yeah, I would say that, a lot of people now, if they find that they need infertility coverage, are seeking companies now that, only companies that will support and help that. And also some people are working at Amazon and along with their full-time jobs. And the way it works with Amazon is if you work, like, I think, 1 full day, you can technically like take medical leave and still keep your COBRA benefits. So people are doing that also and working full time just to make sure that they have coverage. And infertility is, to me, it is a disease like any other disease, like diabetes, like heart disease. And eventually, I hope all employers will cover it, because financially it is very expensive. And that's part of where the mental issues come along, is when you're realizing how much money you're spending. People are taking second mortgages out on their homes. People are working all kinds of jobs, and a lot of people have to go through multiple rounds. So that is part of the mental issues that come along with it, is the financial part of it. So I feel like if, more jobs could support through insurance, and health insurance could support it, it might even just take that much more burden off of individuals going through it, just to make it a little bit easier.
Absolutely. You guys have just touched on some really important issues, and how, all of these other life factors impact our mental health, and how our workplaces and, health systems in our communities can support us, or how we have to reach out and figure out, okay, where else can I get the support that I need? And I'm glad that we have some resources in the chat from NNHLA And Tonya, please do share for anyone joining from Ohio. We have the poem program, and I would like to just take the opportunity to let anyone who's joined us drop questions in the chat, or feel free to unmute yourself and ask a question. I think this is a really welcoming group of panelists, so they'd love to hear what you have to say. And we do have, yes, those lactation rooms for moms. That's a really important point. Some organizations are starting to have those, and it's useful because when you become the sole source of nutrients for your baby, you can't just turn that off or stop at some point. So.
And there's a huge stigma there too. Like women kind of have this catch-22 where there's this pressure based on previous recommendations. I think it was WHO, that women need to be exclusively breastfeeding for 6 months. And so that is something that really has compounded the mental health component through that perinatal window. I do want to squeeze in another fact real quick. The most dire part of this, as we're talking about maternal mortality, there's a pregnant with seed window, the childbirth, but all of these the leading cause of death in the first window, or sorry, the first year postpartum is suicide and overdose. And so this is a very dire issue, both from the maternal mortality rates due to systemic racism, but the dire consequences we have, and all of these are preventable.
Yeah, we've seen the impact that social determinants have had on health really shows itself through, COVID infection rates and COVID vaccination rates and COVID treatment and death rates. And this is what we've known all along, but now it's like a big, kind of poster in front of everyone that, wow, this is what we've been doing to communities for so long. And I see a question came in even about stigma and speaking about, mental health and infertility. So Sherry, do you want to address the question from Daphne?
Yeah, sure. That's a great question. I personally did not experience anyone, talking negatively to me about it, but I do feel like there's a lot of criticism in sharing. And that is what really propelled my advocacy with this, is like breaking the silence of infertility, especially in the Black community, because I feel like there is a deep-rooted historical trend of, it could go back to just, our roots, and at the minimum, you should be able to have a child, or if you're not having a child, then, are you just stressed? Are you this? Are you that? And there's no talk of preserving your fertility when you're younger. And then there's no talk of, once you're going through infertility, people are very ashamed of it and look at it as almost like a disability or something negative along those lines. And that's why a lot of women go through infertility, Black women especially, and experience depression because they feel alone. And when you were talking, Karen, about peer support and, walking into a room and being convicted about, who you are and advocating for yourself, it took me a very long time to share even my husband and I's story. We documented it on YouTube because that's where I found a lot of support initially. And it was really a way for us to journal our experience. But then I was always connecting with women who were African-American women in the same age group of me, and just saying how happy they were that they found my channel, because now they feel like they have someone they can relate to. I have conversations with people all the time, like through DMs, through comments on my YouTube videos. And most of the comments are just about being so thankful that, they can relate to someone else going through it. And I feel like the more that people share and the more that people talk about it, the better off we will be. And National Infertility Awareness Week was Awareness Month was a week, I'm sorry, was in April. And there are a lot of big changes happening, like Progeny, the company that I mentioned that administers my fertility coverage. They actually were able to be there when they lit the Empire State Building orange in observance and respect for infertility awareness. And, the company resolve.org, I'll put it in the chat. They're the ones that have kind of led the charge on National Infertility Awareness Week and bringing more light to it. I do think we have a long ways to go in the African American community because, of racial injustices. We are always feeling like we have to be on anyway. And if you add infertility to that, it's another thing that we have to deal with. But the more that another layer, yeah. And the more that people talk and share, I think the better off that will be.
I see we're really at time, and I feel like we could speak for another 30 minutes, but I do want to allow each of you all to just log off with any kind of remaining thoughts or ideas or messages for the public. We will make sure that this stays up on YouTube. And if there are particular things, all of the resources from the chat will be added to the description of the video. So thank you so much for joining us, and please leave us with your kind of last word.
I'll jump in and say thank you, Karen and MHA, and it's lovely to speak alongside Sherry and Suzanne. And on the close of Maternal Mental Health Week and in Maternal Mental Health Month and Mental Health Month, there's a community in so many places that are here to support folks. And so many systems are not set up to care in so many ways, but encouraging people to reach out. If something doesn't feel right, you're probably right. And there are many of us who are here to help you to the next step.
Yes, thank you, everyone. Thank you, Karen. This was awesome. I'm really happy to be a part of this. And thank you to everyone else, Suzanne and Tanya. It's very nice to talk alongside you ladies.
Thank you so much. I'm really, really grateful to be here during Maternal Mental Health Week, Maternal Mental Health and Mental Health Awareness Months. I'd say the big takeaway is that, for anyone that is experiencing this, whether it be the birthing individual, the partner, family members, adoptive parents, foster parents, there is hope. You're not alone. And with treatment, you will be well again. And those, for those who are ready to use their voice, there are lots of advocacy opportunities. And so you no longer need to feel hopeless or powerless or, a victim of the system. And so again, the takeaway message is there's hope.
Thank you all so much. It's really incredible that the work that you've done, the people that you've touched so far, and I know that there are many others listening that appreciate you for being open and discussing these really important issues in rooms and in places where they might not have been discussed before. So thank you for joining. It's my pleasure to be able to facilitate this, and to everyone in the audience, this will be on NHA's YouTube account, uploaded by Sunday before Mother's Day. So feel free to share it, and we hope everyone has a good weekend. Thank you.
Thank you. Bye-bye.
Thank you.